Welcome back. Well, the government has been urged to lock down Australia immediately in order to curb the spread of COVID-19 by one of the key experts advising their response. Infectious disease expert Professor Raina Macintyre is the Australian government's Principal Research Fellow for the NHMRC. She's also the head of the Biosecurity Program at the Kirby Institute, Professor of Global Biosecurity at the University of New South Wales. She joins me now via Skype. Professor, thank you very much for your time. Ordinary Australians are not expert in epidemiology or indeed science, are grappling with all the different views about what we do and how hard we go. I think everyone has learnt now the theory of flattening the curve. We wouldn't have known anything about it a month ago. Suddenly we're all experts. Give me the arguments why we need to go hard and faster.
So basically, epidemics grow exponentially. So they grow rapidly in size with every day that passes. It's not like something like asthma or diabetes where you can wait months or years to fine-tune your policy. You need to make decisions quickly. You need to act quickly because every day that you delay, the epidemic grows. And most of the research shows and experience shows that a slow trickle approach doesn't work, because you're still getting transmission. And the thing about the COVID-19 is that it does spread without symptoms. So we can have lots of young people probably and children out there who are spreading it in the community silently. And that's probably what happened in the US and why we ended up with huge numbers of cases in the US.
If you look at the big movements in the numbers in Spain overnight, both the people contracting the disease but also the death rate, we have lost a bit of hope with Italy. Italy was looking like, certainly at least the death rate had stabilised. There'd been another 2 days, I think, of falls. It's now jumped up again. What's giving you concern about the data set that you're seeing in Australia?
Well, the main thing is that we have had shortages of test kits and we've been unable to test as extensively as, say, a country like South Korea. They really went to town in terms of the testing, and that's how they got their epidemic under control. So actually only 2 countries have flattened the curve, and that's China and South Korea. With Australia, we have seen a very exponential growth in the cases. Some of those are still travel-related cases, so people coming in from overseas. But we're also seeing community transmission. And the problem is there's probably silent transmission as well that we haven't picked up because we haven't tested.
You made that point there, and it's a very valid point, that a lot of our numbers are still people returning to Australia. My colleague Annalise Nielsen had confirmation from the Department of Home Affairs today that 7,977 Australians arrived back into the country today, nearly 5,000 of them through Sydney Airport. And I've been campaigning on this day in, day out for a few weeks now. We know that when they arrive in Sydney Airport, for a lot of them, it's just a questionnaire. There's no other testing done. And we see from comments made by the police in Victoria, at least today, that people are giving false addresses and they could be anywhere in the community. You can see there on the screen, that's scenes today from Sydney Airport. It's congested. These people are coming from overseas, from countries where there is much more widespread community transmission than Australia. They're Aussies. We've got to let them in, but how serious are we about making sure they don't make a bad problem worse?
Yeah, I think you're quite right, Peter, that we need to make sure that, perhaps there should be some fever screening and there has to be a mechanism for following up on those questionnaires. In some airports around the world, there's a much more extensive screening process, and I think we need to be seriously looking at that because it is a very high risk coming in. And especially if we're not following people up, if they're young people, they could be then contributing to silent transmission in the community.
We know that the issue of testing, you raised it just then, has been front of mind for everyone, and there's a limit at the moment, a set of criteria you must meet to get a test. We know also from the Minister that a lot of this test kit material has come from overseas to date, and the whole world wants these tests. I listened to an interview on Radio 2GB today by Alan Jones with a Dr. Danielle Anderson. She's an Australian who works in Singapore. A number of months ago, she developed a test which requires a prick of blood, a bit like a diabetes test, to test whether you've got COVID-19. Why haven't we moved, do you think, to new testing regimes so that more Australians can be tested?
Yes, I read about that test in Singapore. They were one of the first to develop a blood test. That would help hugely because it'll also be able to give us a handle on how extensive the spread is among children and young people. We really don't know. We've got no basis for saying it's fine, it's not a problem, because we haven't been able to test. And the blood test actually gives you more ability to get a more broad picture of what's going on with the transmission. And I do understand that Westmead, for example, has just finished developing a blood test. So I'm hoping we'll see that more widely available soon.
And just before we go, how long do you think we have? What's our window when it'll be too late to really lock down? You know, up against where we've got to in terms of ICU beds and capacity in our hospital system.
So it's never too late to lock down, but the longer you leave it, the more risk you have of the health system collapsing, of doctors and nurses dying because they were forced to work without personal protective equipment. We've already got a shortage of masks and respirators. And just look at Italy and Spain. You know, there was a video of the Spanish health minister in February the 14th, laughing and telling the Spanish people there was no COVID in Spain and there was nothing to worry about. And 6 weeks later, their health system is collapsing. So I think it's really essential that we move quickly into a complete lockdown to give us a chance to seize control of the situation and start again from a much lower baseline.
Professor Raina Macintyre, thanks very much for your time tonight.
A pleasure.